Hi, my name is Kweku. I'm a pharmacist. In today's video, I want to highlight the use of alpha-lipoic acid or ALA in the management of diabetic neuropathy or nerve pain. Alpha-lipoic acid has been touted to be one of the best, if not the best supplement in the management of diabetic neuropathy. So in today's video, I'm going to look at 5 reasons why I tend to share that opinion to some extent. We would also take a very brief look at how neuropathic pain occurs. This, I believe, will help you better understand the effectiveness of alpha-lipoic acid in the management of diabetic neuropathy. And also stay to the end as I'll be giving tips on how to choose the best alpha-lipoic acid. There are different formulations on the market. One of them is the best, so I'll highlight that particular one. Now, treating painful diabetic neuropathy is quite challenging, and it involves 3 main approaches. Number 1 is to aim at what we call normoglycemia. In other words, you try to bring the person's blood sugar levels to where it's supposed to be. This takes care of the underlying problem because it is the elevated blood sugars that eventually leads to nerve damage and nerve pain. So if you're able to bring the person to normal blood glucose levels, then you're kind of solving the problem from the base. The second approach is symptomatic treatment, where you treat the symptoms of the pain. So you have doctors prescribing medications such as gabapentin, you have pain medications, tramadol, or even in certain cases, you may see the use of some antidepressants, which help in the management of such pain. Now, while this approach is not necessarily a bad approach, you would agree with me that you're only managing the symptoms. And besides, most of these medications come with a slew of side effects that a lot of people are not able to tolerate. Now, the third approach is what we call the pathogenetically oriented therapy, where you aim to delay, to stop, or to reverse the neuropathy. And in so doing, you may also alleviate the pain. So this is where alpha-lipoic acid comes into the picture. And in order to better understand how alpha-lipoic acid works, let's briefly take a very brief overview of how diabetic neuropathic pain occurs. So as you can see on your screen, if you have hyperglycemia, or if you have too much blood glucose circulating in your blood, what happens is that there is what we call oxidation. The glucose becomes oxidized, leading to a process called oxidative stress. Now, this oxidative stress can lead to what we call nerve ischemia, which means that there is inadequate oxygen reaching the nerve cells. And if there is inadequate oxygen reaching the nerve cells, they may die off or they may become damaged and result in pain. It may also result in the formation of what we call advanced glycated end products, or AGEs for short. Now, these AGEs also contribute to some of this nerve pain. So in order for something to be effective at minimizing or reducing this nerve pain, we have to stop the oxidation of glucose. So we have to find a way of getting a very potent antioxidant to reverse or to stop this process. So this leads me into the 5 reasons why I believe alpha-lipoic acid is the best person or the best agent to do that job. Number 1, alpha-lipoic acid is a very potent antioxidant. There have been several studies that have been done to document the effectiveness of alpha-lipoic acid as an antioxidant in reducing diabetic complications. Now, another bonus to this potent antioxidant effect of alpha-lipoic acid is the fact that it engages in what we call antioxidant regeneration. So ordinarily, any other antioxidant, say vitamin E, glutathione, when they do their job of being an antioxidant and they remove all these free radicals and dangerous chemicals from our body, what ends up is that they end up being oxidized. In other words, they are only a one-time use. They are used once and they cannot be used again. Now, guess what? Alpha-lipoic acid is able to regenerate or reduce these other antioxidants again, making them reusable. So that's a very big bonus that alpha-lipoic acid confers on other antioxidants. So if you to use a basketball analogy, alpha-lipoic acid can act as a point guard who makes all his other team members better. The second big plus for alpha-lipoic acid is that it is both water and fat soluble. So that means that it's able to get to pretty much every tissue that it needs to get to. So antioxidants can be either water soluble, we call them hydrophilic, or fat soluble, we call them lipophilic. So for example, water soluble antioxidants include vitamin C and glutathione, and fat soluble antioxidants include coenzyme Q10, vitamin E, and some carotenoids. Alpha-lipoic acid, on the other hand, possesses both qualities. So that means that it is able to reach far more tissues relatively compared to some of the other ones, which may be either just water or either just fat soluble. The third advantage alpha-lipoic acid possesses over other antioxidants is that it has been demonstrated to decrease neuronal sensitivity. In other words, it decreases how sensitive your neurons are to pain signals. This it does by selectively inhibiting certain systems in the body that are responsible for this type of pain, called T-type calcium channels. Number 4 is that there are very minimal side effects associated with alpha-lipoic acid compared to some of the other medications that are used in the management of diabetic neuropathy. I mean, some of the other medications, gabapentin, Lyrica, some of them even come with warnings for suicidal ideations. The only recurring side effect that I saw among all the studies that I reviewed was nausea, and this occurred in people who were taking relatively high doses of alpha-lipoic acid. Number 5 is that alpha-lipoic acid actually helps to reduce blood sugar levels by improving insulin sensitivity. There have been several studies that have been done to demonstrate this effect. So with this, you are actually taking care of the underlying or the root cause of the problem by bringing the person to, as I stated earlier, normal glycemia to prevent further damage to the nerves or to the neurons. Now let's talk about dosing in the use of alpha-lipoic acid in management of diabetic neuropathy. Well, there is really no set standard dose, but most of the studies that I reviewed use dosages ranging between 600 milligrams and 1,800 milligrams. In one particular study called the Sydney 2 trial, they found out that 600 milligrams was good enough to reduce the effects of diabetic neuropathy. When they bumped that dose up to 1,200 milligrams, some people started complaining of nausea. About 21% of the study participants complained of nausea. Nothing that was too much for them to discontinue therapy, but they realized that when they bumped it from 600 to 1,200, they noticed some nausea. So typically people will start with 600 milligrams, and if needed, they may bump up to 1,200 milligrams. But as with all my other videos, I highly recommend that you always discuss with your doctor to make sure what particular dose is right for you as an individual. Also, there have been some studies to demonstrate that alpha-lipoic acid is best absorbed on an empty stomach, so consider that if you decide to take a supplement of alpha-lipoic acid. Now let's talk about some formulations or some types of alpha-lipoic acid that are available on the market. There are two main types, R-alpha-lipoic acid and S-alpha-lipoic acid. Actually, let me say 3 main types, because there's also a mixture where you have the R and the S combined in one particular product. Without beating around the bush, I just go straight to the point and tell you that the best one to get is the R-alpha-lipoic acid. That is the naturally occurring one. Several studies have shown that it is more bioavailable, that it is, in other words, it is better absorbed into the human system than the S. Now, sometimes you will see a combination of the R and the S. The R and the S still does not come up to the level of quality of the R. So if you're going to get any alpha-lipoic acid, you're going to buy any supplement, my recommendation would be to go for the R, even avoid the R and the S, because the absorption of the R and the S doesn't come anywhere close to the R. I'll put some links in the description if you are considering purchasing a supplement at this time. So high level overview of alpha-lipoic acid. Hope you found some value in it. If you did, give this video a thumbs up. On your screen is another video that I think you will find interesting. Stay blessed. Catch you on the next video.